we've noticed in our clinical practice that we've had patients reporting a sense of throat or palatal swelling, and sometimes a voice change, like the voice becoming hoarser, or finding it more difficult to speak how they normally would, not in terms of word finding, but more in the character of their voice. And so we just sort of decided to do this study just to retrospectively look at how frequent that reporting was amongst our clinical cohort. And then kind of on the back of that, to see if there was any association with the other symptoms that they reported, if there was any difference in different headache types, and if it seemed to correlate with the site of pain, because typically cranial autonomic symptoms are mediated via V1, but obviously the throat and larynx are further down in the trigeminal distribution. And so we were keen to see if there was any association with pain. So that's really what we set out to do, knowing well that we weren't as systematic about asking about these symptoms historically as we are now. But it was more just to get an idea of what the frequency of reporting was, and if they could be cranial autonomic symptoms that we need to evaluate further in the future. So we found that 56 patients reported voice change and or throat swelling as possible cranial autonomic symptoms across our clinics, which included the whole range of primary headache disorders. Unsurprisingly, the most common diagnosis was chronic migraine, because that's what we see the most in our clinical practice, given that migraine is the most prevalent of all the primary headache disorders. But it was reported across a range of the TACs as well, so hemicranial continua, episodic and chronic cluster headache, SUNCT and SUNA. And we found that there was 7 patients that reported both symptoms, but we didn't really have a big enough sample size to know if that was significant, if they could be co-associated symptoms. But there did seem to be a significant association with the reporting of ear fullness, which is another cranial autonomic symptom, which is quite well recognized. And that sort of led us to think about whether it was possible that it was related to trigeminal distribution, given that the ear and the throat are likely to be in the same distribution. So we looked at pain distribution, and actually 2/3 of patients had pain solely or including the V3 trigeminal distribution. So that was quite interesting and suggested that maybe these symptoms follow a somatotopic endophenotype, and this is something that we need to look at going forward.